も死んでいる。
Choose your character.
Patient selected. This must be Mr. Rohan's office. Hello.
Hello. What seems to be the problem? I'm Mr. Rohan.
Yes, Mr. Rohan. So you see, I was walking at a park, and someone beside me was smoking, and I accidentally inhaled the smoke, and suddenly, what should I do?
Well,
Build on the size guy! Build on the size guy! Build on the size guy! Science rules! Build on the size guy! Inertia is the property of matter! Build on the size guy! T minus 7 seconds! Build on the size guy!
oof, dang. That smoke could really hurt your health and well-being. Well, let me tell you a little something about health and well-being. Inhaling smoke can swell up your lungs, and it's going to stop you from inhaling oxygen, and that could lead to several bad things.
And did you know healthcare around the world costs too much for people who can't afford it?
Although healthcare is a basic need for every person, it used to be a big social issue and still is now. Healthcare is a need for every person, and we need to try harder to get that to everybody.
Healthcare has been a major issue since the mid-1940s.
Good healthcare is important. If somebody gets a really bad illness but can't get the healthcare to help it, then they risk dying and possibly spreading the disease. This could lead to horrible things.
More than half the world's global population is in need for essential health services. So what do you think needs to be done, Dr. Rohan?
I think that healthcare needs to have a much more reasonable price.
Bye, Dr. Rohan. See you another day.
See you, Max. Wow, he was stupid.
I heard that.
Here's more facts about good healthcare and good living.
When we check up with a doctor, our weight, genetics, and behavior is important. We measure the health of communities and nations by talking about things like life expectancy, medical staff, mortality rates, and medical costs. In some places, there are lots of doctors to help patients, but it's not the case as in everywhere. Unhealthy habits can have a negative effect on our health and well-being. They're eating unhealthy habits and drinking too much alcohol and smoking cigarettes. You can become sick with unthinkable things like obesity and heart disease or heart attack. Unhealthy infrastructure like poor sanitation can lead to the spread of communicable diseases like malaria, diarrhea, and flu, like poor sanitation and lack of clean water. And mismanaged healthcare systems can worsen the spread of non-communicable diseases to treat patients or the money for medicine. And in places where healthcare is not free, some people cannot get the help that they need because they can't afford it. By 2030, 2/3 of all humanity will live in urban areas. Cities provide an excellent opportunity for many governments to protect and promote health at many levels. 23% of deaths is caused by pollution and environmental issues. 90% plus of the world's population breathes unclean air that do not meet the recommendation from the World Health Organization. Some 235 million people suffer from asthma. It's the most common non-communicable disease amongst children. So what is the goal, you might ask? Well, to ensure healthy lives and promote well-being for at all ages.
It's time to stop, drop, and read wherever you are, whatever you're doing for 15 minutes.
Are you kidding me?